All right, so I'm here with Dr. Ronak Patel, one of the superstar naturopathic doctors at the Dr. Maura practice. How are you?
I'm doing well, Dr. Maura. How are you?
I'm good. So we were talking prior to this about what we wanted to chat about. Dr. Patel sees a lot of thyroid patients in our practice. And so we're going to chat a little bit about what he sees. So tell me, what does the thyroid do? Like if you had.
Yeah, that's a great question. So thyroid is a master metabolic organ, one of several, but it's located on your trachea, on your neck here, and it's in charge of a lot of different processes in the body. And
Mhm.
oftentimes I like to look at it at our first visit to really get a snapshot of, what could be going on.
Great. And what are the symptoms people usually come in with?
Yeah, great question. I typically see low thyroid function more commonly than high thyroid.
Mhm.
But with like a low thyroid, I'll typically see stuff like fatigue, brain fog, hair thinning, hair loss, dry skin, cold hands or feet, sluggish bowels, bloating,
Yeah.
low mood. Obviously, the list goes on, but those are,
Yeah.
a myriad of different symptoms where, hey, I feel tired and I want to
Yeah.
exercise, sure, but there could be, something else going on.
Right.
So,
Yeah. You hit all the big ones. So when we think about cause, so as naturopaths, people come to us to look at the cause, right? They're, kind of maybe don't want to be on thyroid meds or want to take a different view of it. So when you think about causes of low thyroid, what are you looking for?
yeah, typically, so that's a loaded question. I mean, so basically, I want to think simple first. So,
Mm,
are you eating the right nutrients? Are you absorbing them? So, thinking about gut function first and foremost. But then I also want to think about environmental factors. Stress plays a role,
yes.
heavy metals, just different
Mhm.
stuff in the environment, endocrine disruptors, as we call them, that can definitely affect thyroid function.
Yeah.
But I really try to just individualize it because everybody's different. Their lifestyles are different. Their diet's different.
Yep.
But the beauty of what we do is we really try to get to know you and kind of target treatment a little bit better. So,
Absolutely. Yeah, gluten a big one with autoimmune hypothyroid, right? Hashimoto's
mhm,
seems to be a big one that we look at.
for
So
sure.
not everyone needs to be gluten free, but that seems to be one of them.
Yep. Big time.
So when you think about treatment, where do you go? Like I said, we get people who've come in, they're on thyroid meds, they're not. Like, what is your
hmm
first thought usually?
Yeah. First thought is testing. So I'd like to get a snapshot of, hey,
Mhm.
not just TSH, which is the signal from brain to thyroid, or
Right.
T4, which is your inactive thyroid, but looking at free thyroid levels, looking at antibodies to see if it's autoimmune in nature or not. And then I like to back up a little bit in terms of, hey, are you on medication? Let's test it still. Let's see what's going on. Maybe
Right.
you're not converting it properly. Otherwise, if you're not on any medication, maybe we can use natural medicine, which is what we specialize in terms of making more inactive thyroid and converting it properly. There's a lot of different cofactors for both of those things.
Iron, selenium, B vitamins, we see people deficient in a lot. Yeah.
Yep.
What?
Iodine, tyrosine, right?
Yeah,
So,
absolutely. And one thing I
mhm.
see a lot, and you tell me if you see this, is that the labs often lag behind the symptoms. So people come in very symptomatic of hypothyroid, but their labs look normal. What do you do in that case? Do you treat or?
Yeah, and also kind of, and I look at a myriad of different things at our first visit. So looking at gut function first and foremost, and then looking at thyroid, looking at your
Right.
adrenal function and the entire HPA axis, as we call it, and potentially male or female hormones also. So connecting all the dots, but maybe, and oftentimes in our experience, thyroid is a big one,
Yeah,
and really working on, you know, simple steps first, and then working more complex as we work together. So.
absolutely. And
Mhm.
thyroid, having a diagnosis of hypothyroid isn't a life sentence, right? We can fix a thyroid, right? I mean, that's
Right, right.
so.
And I've actually seen like autoimmune antibodies
Mhm.
normalized, whatever
Yeah,
that, could mean for the patient. But
yeah,
it's just we see this kind of shift as we kind of optimize nutrition and cofactors, and
absolutely.
stress is a huge one that
Huge,
often,
huge. Yeah,
just working on all these different factors as a whole.
definitely. I love it. The power of naturopathic medicine. Thanks
Love
so
it too.
much.
Yeah,
Thank you.
you're welcome.